Good morning, I'm Dr. Gail Newell, County of Santa Cruz Health Officer. Thank you for joining us on a rainy Saturday morning. The County of Santa Cruz Public Health Division is announcing its first case of the novel coronavirus COVID-19. On Friday evening, March 6, 2020, last night, test results confirmed a COVID-19 diagnosis for a resident who previously traveled on the Grand Princess cruise ship from San Francisco to Mexico, February 11 to 21. This case was not acquired through community spread. That's very important to note. We have no evidence of community spread in Santa Cruz County at this time. This individual is resting comfortably at home and is not requiring hospitalization. Santa Cruz County Public Health is conducting a thorough investigation to identify any potential exposures that may have occurred. Due to medical privacy issues, the county is not disclosing identifying information regarding this individual. We are taking the situation very seriously and taking all steps necessary to protect the health and safety of Santa Cruz County residents and visitors. The California Department of Public Health has previously issued alerts to counties of an exposed risk due to travelers returning from the Grand Princess cruise ship, referred to as GP1, the Grand Princess leg of travel to Mexico. The same ship is the one offshore from the Monterey Bay, which was traveling to Hawaii. Those passengers have not yet disembarked. Several of the Grand Princess travelers from the Mexico leg of the trip are residing in Santa Cruz County. All are being actively monitored and are under self-quarantine with daily contact from public health officials. Testing is requested for those exhibiting symptoms. While COVID-19 represents a serious public health threat, the risk to Santa Cruz County residents remains low. That's important to note. The risk to Santa Cruz County residents and visitors is low. However, as the outbreak continues to spread, Santa Cruz County Public Health anticipates there will be additional reported local cases. On March 4th, I declared a local health emergency, and the county activated its Emergency Operations Center to bolster response efforts. Santa Cruz Public Health is investigating potential exposures, collaborating with local, state, and federal agencies to implement containment efforts, and providing notifications to the public and community agency as the situation evolves. Any new virus brings a great deal of community concern. We are prepared for all situations that arise. We want to remind individuals that this virus does not discriminate and people should not be excluded from activities based on their race or country of origin. Symptoms of COVID-19 are similar to the flu, which include fever, cough, and shortness of breath. Symptoms may appear in as few as 2 days or up to 14 days after exposure. If you have symptoms of COVID-19 and may have had contact with a person with COVID-19 or had recent travel to countries with COVID-19 outbreaks, contact your primary care physician's office. Before seeking medical attention, call first to prevent possible transmission in the healthcare setting. Santa Cruz County Public Health strongly urges community members to take precautions to help prevent the spread of illness. This includes washing your hands with soap and water, rubbing for at least 20 seconds. If you're unable to do that, you should use an alcohol-based sanitizer. Cover your mouth and nose with a tissue or your sleeve, cough into your elbow, not your hands. Don't touch your face. Regularly clean surfaces touched by many people. Stay home if you're sick, that's very important. And it's not too late to get a flu shot to protect yourself and others from flu, which has similar symptoms to COVID-19. This is an emerging, rapidly evolving situation, and the information contained and released here may change quickly. We'll keep you up to date with any changes. The CDC, Centers for Disease Control, will provide updated information as well as it becomes available. You can go to CDC Online and Google coronavirus for all of the latest information and updates with very specific guidelines for different organizations, individuals, and families. Locally, residents may call 211 for general information or text the word coronavirus to 211-211. They can also visit our website at the Public Health Division, which is www.santacruzhealth.org/coronavirus. Thank you.
Thank you, Dr. Newell. My name is Mimi Hall, and I'm the Health Services Agency Director for the County of Santa Cruz. And what I wanted to do in follow-up to an appreciation of Dr. Newell's comments is to let the public and our partners know that we have been planning and preparing for our response to coronavirus for the last 7 weeks. But beyond that, every local health jurisdiction has emergency preparedness, public health emergency preparedness, and hospital preparedness programs. So we feel very well situated and prepared to not only respond now, but to anticipate the changes that we'll have to make in the future as the situation changes quickly. I want to remind everybody that every local health department, which exists in every county in California, is part of the local health system that includes each state and the federal government. And we're all working in lockstep at the local, state, and federal level to ensure that we're taking care of our residents in the best way possible. My message to the entire community is that we all need to be prepared. Government alone is not going to have the resources to step in and assist every individual, family, and community organization. So the three most important things our community can do is for your if you're an individual and for your household, stay well. That means taking the precautions that Dr. Newell talked about. It also means keeping up to date with reputable information from a government source about how to protect yourself and the presence of disease in your community. And the other thing is, if you work in an organization, you're part of other things, that you also consider taking all of the measures for organizational preparedness and work with your employers, work with your faith community. We will be posting regularly updated guidance for organizations, for businesses. We anticipate that there will be guidance coming out soon from the state for local health jurisdictions on large events and mass gatherings and potentially school closures. So it's important for communities, families, and individuals to prepare for the possibility of events being canceled, school being out. And what this does not mean that we have all of a sudden increased risk in the community. What it means is we're preparing to lessen the impacts of the spread. We have limited resources, and the best thing that we can do when there's a new disease or even an existing disease is to slow the disease curve. So the fewer people that are getting sick at the same time, the less there is a tax on our limited local resources. The final thing I want to say is that over the last few weeks, we have deployed an enormous amount of local commitment, time, and energy to help our community partners and coordinate with our hospitals, our schools, our EMS system, and community partners. And we have created structured and regular avenues of communication, both through 211 and also through weekly partner calls with the healthcare system and also schools and community organizations. I want to just express my appreciation for our epidemiology team, our communicable disease unit, and all of our local health system partners that have worked so incredibly well with us to ensure that we protect our community and help safeguard everybody. Thank you.
We'll take questions. Do you know how many Santa Cruz County travelers were on that ship?
We are not releasing numbers other than our numbers of confirmed cases, which is now 1.
Can you say it?
And not even the age range of the person that was confirmed as a case?
No, I'm sorry.
Can you say how long they were back in the county before they realized they had coronavirus and then they were kind of operating in community?
This individual returned along with the rest of the passengers from the Mexico portion of the Grand Princess Cruise on February 21st. Has generally been resting at home. The individual traveled directly from the Port of San Francisco to their home with a private driver.
And can you say where in the county they live?
Can't say that. Sorry, we want to be transparent, but we're also protecting patient privacy.
You said this is the same ship that's now off the coast right now?
That's correct.
Okay, so all the passengers that came from Mexico disembarked, and now that's a full set of new passengers on that ship right now?
Most of the passengers disembarked, some continued on, as did the entire crew.
Okay. Have you gotten a lot of discrimination cases regarding COVID-19?
We have had a number of complaints, and I'm sure that there are other complaints that we have not heard about ethnic and racial discrimination around fears of the coronavirus.
Where are we with test kits? Are there test kits in the county?
We do have test capability in the county. We are not performing the test itself. However, we have agreements with both Santa Clara Public Health Lab and Monterey Public Health Lab to perform testing for us.
Thank you.
I guess what could you say, Doctor or Mimi, about, just trying to console the public, with, you can't give too many details of where this person is or how old this person is, but how do you just, ease the public in this threat?
Well, there's two very reassuring things about this. The first is that this is a travel-related case and not a case of community spread. So, as I mentioned earlier, we don't have any evidence that the COVID-19 virus is spreading throughout the county of Santa Cruz through the general community at this time. And secondly, the patient is well and resting at home. And so that's good news for the family and the individual. And so the risk remains very low to the residents of Santa Cruz County overall.
Was it advised to school districts here in the county to prohibit travel for school games? There's a lot of sporting events that are going on. I don't know if that was advised by the public health to do that.
We've been in close contact with the County Office of Education and individual school districts, and we're working really hard with the California Department of Public Health as they develop guidelines. The guidelines are to be released today around school dismissals, closures, field trips. Amy, do you have something to add?
I would add that those guidelines will be a joint guideline issued by California Department of Public Health as well as California Department of Education.
Did I hear it right, please, that the ships are traveling to Mexico 10/11 to 10/21?
That's correct.
And do you know where in Mexico?
The itinerary is posted for public use. You can Google it and find out.
All right.
But what I remember is it did multiple stops between the Mayan Riviera all the way down to Cabo.
Thank you. And are you folks working in concert with Mexican officials on this? Like, would contact aid in Mexico, or is that getting weird here yet?
The federal government is working with the federal government in Mexico.
Fair enough, thank you.
Has any other passengers that are from Santa Cruz County said anything about symptoms they might be having, or just the one individual so far?
The passengers that we are monitoring, none of them have developed symptoms at this point. This is the same cruise from which the passenger disembarked that was California's first death in Placer County. So it's the same cruise ship. Same trip.
Anything else?
And you guys expect there to be more cases as we start testing, or do we think that we're just going to be contained with the one?
We anticipate that, as do our state and national leaders, that COVID-19 will become community spread across the nation as it has around the globe. So we anticipate that we will have increased activity here.
And I would like to add that much of our planning activity is around that anticipation, rather than waiting for community spread in Santa Cruz County or further spread in the Bay Area. We know that it's an inevitability, and the more that we plan right now, and we can let our schools, our organizations, our businesses know what may be coming down the pike, the better our community can prepare for those potential disruptions in their daily lives.
Can you give us an example of some of the things that you have planned so far for the county?
Well, we have been, one of the things that Dr. Newell mentioned is we have been thinking for the last several weeks about mass gatherings and school closures. And as I mentioned, we're part of a system, of a local, state, and federal public health system. So there's been much activity over the last 3 days to work with California Department of Public Health on those recommendations for mass gatherings and school closures. So as Gail said, as Dr. Newell said, those are expected to be released today. One of the things that I want to note is that local health jurisdictions have, so for example, in the last couple of weeks, we had experienced testing shortages. So in situations like that, we may have to do things on a local basis that are decided by our health officer, who has that authority, that may stray from national guidance. So if there's national guidance that says testing is widely available and we don't have the capacity, our health officer helps to prioritize in triage on a local level.
Commercial testing will be available on Monday through 2 different commercial labs. And so we expect wider testing availability. But I want to emphasize that we are not recommending testing for people who are not sick, who are not showing symptoms. That wouldn't be helpful because we don't know what that means. So we want to test only symptomatic individuals. So individuals who are showing fever, cough, shortness of breath, wheezing.
And do those people have to have a referral from their doctor prior?
It would need to be an order from their physician or other clinician.
One of the things that we are asking people to do is not go to your doctor's office and not go to the emergency department to ask for a test. So if you feel like you may have been exposed, you're worried that your symptoms may be COVID-19, we're asking them to call ahead their primary care provider. You should only be presenting to an emergency room if you're ill enough to need to go there. Because just as with measles or any other communicable disease outbreak, we want to keep transmission low and interaction with public healthcare workers and others low.
The public should also be reassured that most cases of COVID-19 will be mild, as with this individual, and those folks can recover at home and perhaps not even be tested. So again, we're recommending that people who might have symptoms can stay home. They should not go to the hospital unless they are hospital sick. In other words, so critically ill that they might need to be admitted to the hospital. This is not the time to go to the hospital for testing.
Dr. Noel, I might make one mention about supplies. So many of you may have heard through the media that there are limited supplies for N95 face masks, other kinds of masks. So we want to assure folks that from a medical perspective, and Dr. Newell, I'll defer to you if you have anything to add, we are not recommending that healthy people wear masks. Masks are not meant for those who are healthy. There are standards for healthcare workers who may have exposures, but you may see lots of people scrambling to buy surgical masks. Masks are only recommended for those people who are ill and experiencing symptoms to prevent others from getting sick from them.
And masks need to be prioritized for people who really need them in their line of work, such as healthcare workers and first responders. Thank you all for
Okay.
being here today, and we look forward to continuing to share information with you as it develops.
Thank you.